This gel is designed to treat acne by reducing the number and severity of acne pimples and promoting quick healing of pimples that do develop. It belongs to a class of medications called retinoids and works by affecting the growth of skin cells. It is important to use this medication as directed by your doctor to achieve the best results. Apply a thin layer of the gel to the affected area once a day in the evening, after washing your face gently and patting it dry. It is important to avoid applying this gel to sunburned, windburned, dry, chapped, irritated, or broken skin. Always use sunscreen and wear protective clothing when going outside, as this medication may increase your skin sensitivity to sunlight. Before applying Atralin gel, make sure to wash your hands and clean the affected skin. Use a mild or soapless cleanser and gently pat dry. Then apply a small amount of the gel in a thin layer as directed by your doctor, usually once daily at bedtime. You can use your fingertips, a gauze pad, or a cotton swab to apply the liquid. Some preparations may require you to wait 20 to 30 minutes after cleaning your face before applying the gel. Remember to only use this medication on the skin and avoid applying it to the inner lip area, inside the nose/mouth, or on cut, scraped, sunburned, or eczema-affected skin. Also, be careful to avoid getting the gel in your eyes, and if it does happen, flush your eyes with water and contact your doctor if irritation develops. In the first few weeks of using Atralin gel, your acne might appear worse as the medication works on pimples forming inside the skin. It may take up to 8 to 12 weeks to notice results from this medication, so be patient and continue using it regularly at the same time each day. Atralin gel is available in different strengths and forms, such as gel, cream, or solution. Your doctor will determine the best type of medication for you based on the condition of your skin and your response to therapy. Be sure to inform your doctor if your condition lasts or gets worse. After applying Atralin gel, you may experience warmth or stinging on your skin. Skin redness, dryness, itching, scaling, mild burning, or worsening of acne may occur during the first 2 to 4 weeks of using the medication, but these effects usually decrease with continued use. If you have very dry skin, using a daytime moisturizer may be helpful. If any of these effects last or get worse, it's important to tell your doctor or pharmacist promptly. It's essential to remember that your doctor has prescribed this medication because they have judged that the benefit to you is greater than the risk of side effects. Most people using this medication do not have serious side effects. However, if you experience blistering/crusting of the skin, severe burning/swelling of the skin, or skin discoloration, it's important to tell your doctor right away. While a serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you notice any other effects not listed above, be sure to contact your doctor or pharmacist for guidance on what to do next. Before using Atralin gel, make sure to inform your doctor or pharmacist if you have any allergies to tretinoin, vitamin A-related drugs, or any other allergies. This product may contain inactive ingredients that can cause allergic reactions, so it's important to talk to your pharmacist for more details. Also, be sure to inform your doctor or pharmacist about your medical history, especially if you have eczema. Atralin gel may make you more sensitive to the sun, so it's important to limit your time in the sun and avoid tanning booths and sun lamps. Weather extremes such as wind or cold may also be irritating to the skin, so it's recommended to use sunscreen daily and wear protective clothing when outdoors. If you get sunburned or have skin blisters/redness, be sure to tell your doctor right away and wait until your skin has completely recovered from a sunburn before using Atralin gel. While using this product, it's best to avoid electrolysis, waxing, and chemical depilatories for hair removal on the treated areas. If you have recently used products containing sulfur, resorcinol, or salicylic acid, it's important to use Atralin gel with caution and wait until the effects of such products on the skin have decreased before using Atralin gel. If you are pregnant, Atralin gel should only be used when clearly needed, as it may harm an unborn baby. It's important to discuss the risks and benefits with your doctor. Additionally, it is unknown if this drug passes into breast milk, so it's recommended to consult your doctor before breastfeeding. It's important to be aware of potential interactions with other medications and products. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid using harsh or drying skin products on the treated area, such as hair perming solutions, alcohol/lime/menthol containing products, medicated or abrasive soaps, and cosmetics with a strong drying effect. Additionally, benzoyl peroxide can be very irritating and may decrease the effectiveness of tretinoin if applied at the same time, so it's best to talk with your doctor or pharmacist about the safe use of prescription and non-prescription benzoyl peroxide products. If this medication is ingested, it can be harmful, and immediate medical attention should be sought. Contact 911 or a poison control center right away if an overdose is suspected. In the U.S., residents can call their local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center. Remember not to share this medication with others. You can use cosmetics, but make sure to clean your skin thoroughly before applying the medication. Certain cosmetics and soaps may make your acne worse, but moisturizers should be safe to use. When purchasing cosmetics, moisturizers, or other skin care products, look for labels that say non-comedogenic or non-acnogenic. These products are unlikely to worsen your acne. It's important to ask your doctor or pharmacist which products are safe to use. Also, keep in mind that acne is not caused by dirt. Cleaning your skin too often or too vigorously can actually irritate your skin and make acne worse. If you forget to use Atralin gel, use it as soon as you remember on the same day. If you don't remember until the next morning, then wait until your next dose is scheduled. When it comes to storing Atralin gel, it's important to keep it at room temperature and away from any heat or fire sources, as the gel preparations are flammable. It's also crucial to keep this medication out of reach of children and pets. When it comes to disposing of Atralin gel, it's important to not flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you have any questions about how to dispose of Atralin gel, make sure to consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.